Richmond, Virginia. This is Virginia This Morning.
Well, this month we've been highlighting some of the most popular cosmetic procedures for you. We've already checked out liposuction, tummy tucks, and rhinoplasty, better known as getting a nose job. Well, today we conclude our special series with a look at facelifts. Our guest is Richmond plastic surgeon Dr. Mason Williams. Good morning, doctor. Thanks for joining us today.
Good morning.
When we talk about facelifts, are we talking about a drastic operation or can it be more subtle?
Well, it certainly can be subtle, and it's certainly better to do it before extreme things have to be done.
Let's talk about what exactly a facelift is. What is the procedure we're talking about?
Well, the term facelift is actually a misnomer because it's actually a lift of the neck and the lower face. And the procedure actually works by repositioning and tightening the skin in the underlying tissues of the neck and the lower face, and then trimming off and discarding the extra skin.
So if we were doing like getting our eyes or eyebrows or something like that done, that's not considered to be a facelift, or that can be part of a facelift?
Well, oftentimes they're done in conjunction with a facelift, but they're separate procedures. But I think that it is important to look at the entire face and neck and look at all the procedures that are going to make things look like they belong together.
Of course, we can see the physical results of a facelift. What about the psychological aspect of getting a facelift? Can you talk a little bit about that?
I think that sometimes in this day and time, people come and are very concerned about spending the money on a lift, and are they doing something frivolous? But most of these patients have a pretty high body self-image and are very concerned about their physical appearance. And it just goes along with their personality in having it done.
Well, you mentioned the cost of getting it done. What does a facelift cost in general?
The cost of the facelift, comprehensive cost in my office is $8,300, and that includes all of the operating room costs and supplies, the anesthesia, the surgeon's fee, and the post-operative visits.
We're taking a look at some before and after pictures. These are some patients of yours, and there are definite changes that can be made, aren't there?
Yes. Let's see if we could see the pre-op again, but this is a woman who comes with rather typical changes of this fullness and waddle of extra skin and fat in the neck, and she also has the jowling that you can see, which is the extra skin and fat along her jawline, and some fullness of the medial cheek. So those are what we are after correcting and doing the lift and getting correction of the neck, getting a nice angle again, smoothing the jawline, and taking out some of the weight in the middle part of the face. And from a straight-on view, she just has a fresher look.
Definitely a more youthful look to that. Once you get the procedure done, what's the recovery period like?
Well, there's a large circumferential dressing that's removed on the first post-operative day, and then patients come back 1 week later to have their sutures removed and for a general check. They're usually back to work within about 2 to 4 weeks. It can be as long as 3 to 4 weeks of total loss of all of the swelling and bruising. But actually, I have some female patients who will come back the first week after surgery fully made up and looking pretty terrific already.
Well, makeup can cover a lot of things.
That's exactly right.
What are the risks involved in a surgery like this?
Well, the risk for this surgery should be small, and I think that's the importance of choosing a surgeon with good experience who've learned all of the little extra innuendos and techniques over the years so that they can get the best result and avoid problems. The risks are small chances for excessive bleeding, infection, poor scarring, some asymmetries of one side of the face to the other, and low chance for nerve damage or loss of motion in a portion of the face.
And who's the ideal candidate for a surgery like this?
Well, there certainly are better candidates than the others, but as we were talking just a while ago, I often tell patients that it's better to come in when this can be a refresher, not a rescue mission. So don't wait until it's too extreme, but do it when you can have a fresher look without it being extreme.
It's all about feeling good about yourself.
That's exactly right.
Dr. Mason Williams, thank you so much for joining us today.
Well, thank you very much for having me.
You're very welcome. Now over to